I feel like I've seen a lot of variety. That's just the big difference from what I saw. I'm glad I'm almost done. Hey guys, Nurse Abby here, almost Nurse Abby. I've not made a video in a while. I have been busy, definitely. I'm on my last half of my second to last semester of this ABSN program. The first half of this semester was not too bad. I had maternal health, like pregnancy, labor, newborns, and ethics, I think. Or was it? No, it was evidence-based practice. I don't know. Maybe it was ethics. It was not too crazy though. It was a doable schedule. The second half of this second to last semester has been pediatrics and leadership, and there is just a lot of work with it. They actually reduced our peds clinicals. It's only 45 hours and I've gotten 3 done. I have 1 more day to go in for 9 hours. It's been good. I'm at a hospital that has all different types of peds patients all on the same floor. So like cancer, RSV, neurological, surgical, recovery, there's only 1 peds floor in this hospital. So there's, you know, ICU, step down ICU in general, but it's all the same acuities. But the good thing about clinicals, where I have my clinicals, I mean, I would highly recommend the hospital I was at for clinicals because I'm getting to see a lot of different things. In my peds clinicals, I saw a 15-year-old who was intubated from a drug overdose and needed some more sedation meds to keep him from trying to pull out his, not trach down here, intubation up here. Saw them work on intubating a baby with RSV. It was a very difficult intubation, had some problems, a lot of RSV. Was able to see a sickle cell case. That's most of it. Most of it's been respiratory, sickle cell, a drug overdose, a child that normally had a trach, those having some respiratory illness. But I feel like I've seen a lot of variety and a good variance in acuity at my clinical, but it's not where I would want to work if I wanted to work with peds, because the pediatric nurses have to do all the types of peds. I mean, maybe it would be good to get a general idea if I didn't know what area I was interested in, but if you go to a big hospital like Raylan goes to St. Louis Children's Hospital, you would get assigned a specialty within peds, and you could really, I feel like, focus and feel more confident in your knowledge because you're not having to learn a little bit about everything. Like, they get the diabetic patients, they get the cancer patients, they get the sickle cell patients, they get the respiratory patients, they get the surgical patients. Like, they get all of them at St. John's where I'm doing my clinicals. Whereas St. Louis, if you work on the 12th floor, you're going to sometimes get surgery patients that have neurology issues. 12th floor is neurology, but you're always going to have neurology patients. You're going to be a specialist in the neurology, or you're going to work on the cancer floor and you're going to become a specialist in the cancer stuff, or you're going to work on the med surg floor and you're going to become a specialist with the wound vacs and, you know, the surgery complications and stuff like that. So I just know, as a parent, I want to take my kid to the bigger hospital where the nurses are working usually with my kind of kid. And as a new nurse, I would want to work at the bigger hospital where I'm going to get more training in a specific thing instead of having to try to learn and do it all from the beginning. Now, there are nurses at St. Louis Children's that are in the float pool and they go to all the floors. So not that you can only learn one thing, but that's just the big difference from what I saw, you know, as a parent at St. Louis Children's Hospital compared to where I'm doing my clinicals at St. John's, where it's much smaller.